Hi everyone, my name is Ellen and I'm one of the neonatal dietitians, and today I'm going to be talking about feeding your premature baby post-discharge from the neonatal unit. This video is for you if your baby was born less than 35 weeks and less than 2 kg. If your baby was born less than 35 weeks, that means your baby was premature and they have different nutritional requirements than a term baby would have. They have higher requirements for both energy, protein, vitamin D, calcium, phosphate and iron. All of these vitamins and minerals are really important for your premature baby. Breastfeeding is the best form of nutrition for your baby. It has many immunological benefits, benefits for their gastrointestinal tract, benefits for long-term outcomes, and many benefits for mum also. If you are breastfeeding and you're giving expressed breast milk to your baby, you should add fortifier to your expressed breast milk. This fortifier contains extra energy, protein, vitamin D, calcium and phosphate, which will meet their preterm nutritional requirements. The fortifier should be continued until a minimum of 4 to 6 weeks post-discharge from the neonatal unit and up until 3 months corrected age. Your doctor will tell you in your outpatient appointment whether you should continue fortifier or whether you can stop fortifier early, depending on your baby's growth. If your baby is breastfeeding and latching to the breast, you do not need to give fortifier. You should just add fortifier to the expressed breast milk that you're giving to your baby. You do not need a prescription for fortifier, and you can get fortifier in your local pharmacy. Just make sure before you're going home from the neonatal unit that you call your local pharmacy to make sure that they order the fortifier to have in stock before you go home. Preterm babies who are breastfeeding or feeding expressed breast milk will need to start an iron supplement when they are 2 weeks old. So iron is really important for premature babies. Premature babies are at risk of iron deficiency anemia. This is because it is in our 3rd trimester of pregnancy that babies accrue their iron stores, and these iron stores should last them until they're 6 months of age. For premature babies, they don't get the chance to accrue these iron stores, and so we need to give them iron supplements. Giving the iron supplement is really important. If you don't give the iron supplement, your baby might feel tired, they might struggle with their feeds, they might have difficulty feeding, they might have difficulty with their breathing, and they might also have difficulty growing. So it's really important to give your baby their iron supplement. This supplement starts at 2 weeks of age, and the dosing will be given to you by your doctor. So they should give you a script before you go home for starting iron at 2 weeks of age. This should continue until your baby is 6 months corrected age, until they're getting enough iron from their diet. Babies who are on SMA fortifier will not need to take an iron supplement because iron is included in the SMA fortifier, but babies that are taking cow and gate fortifier will need an iron supplement. So if your baby is taking cow and gate fortifier, they need to start an iron supplement at 2 weeks of age. Make sure to get a script for this before you go home from the neonatal unit. If your baby is breastfeeding or taking expressed breast milk, they will also need a vitamin D supplement. Vitamin D is really important for your baby to make sure they have strong and healthy bones. Your vitamin D supplement should be started while your baby is an inpatient here in hospital, and when they're discharged, you should continue to give this vitamin D supplement until they're 6 months corrected age. And then HSE guidance should be followed until they are 1 year corrected age. A script for the vitamin D supplement should be given to you by your doctor before you go home from the neonatal unit, and you can also get a script when you go to your outpatient appointment. If you're combination feeding, so if you're breastfeeding, giving expressed breast milk and giving formula, then you should discuss with your doctor or your dietitian as to whether your baby needs a vitamin D supplement. But usually babies that are taking more than 300 ml per day of formula don't need a vitamin D supplement, and if they're taking less than 300 ml per day of formula, they do need a vitamin D supplement. If you are formula feeding your baby, you will be giving them a preterm formula. So preterm formulas differ from term formulas in that they're higher in energy, they're higher in protein, and they're higher in vitamins and minerals such as iron, vitamin D, calcium and phosphate. Preterm formulas are there to reach your baby's preterm requirements, so it's really important that your baby is getting a preterm formula and not a term formula if they're born preterm. Cow and Gate NutriPrem 2 and SMA Gold Prem 2 are both suitable preterm formulas to give your baby. You don't need a script for preterm formula, but you should call your pharmacy prior to going home from the neonatal unit to make sure that they have the preterm formula in stock for you for when you go home. How long should you continue the preterm formula? So we would usually recommend that the preterm formula should be continued until your baby is a minimum of 6 weeks corrected age. At this point, they'll be going to their outpatient appointment for their 6 weeks corrected check, and the doctor will tell you as to whether you should continue the preterm formula or whether you can discontinue the preterm formula and switch to a term formula. Term formulas that are suitable are just number 1 formulas. So any number 1 formula on the market is suitable to switch to at this stage. If your doctor advises you to continue with preterm formula, it might be simply that your baby just needs a little bit more calories, protein, vitamins and minerals for a little bit longer to help with their growth. When your baby is on preterm formula, that contains enough iron to meet their nutritional requirements. But when they stop their preterm formula and they transition over to term formula, they should start an iron supplement. You should get an iron prescription before you go home from the neonatal unit to start when you transition to term formula. Your doctor will advise you on the dosing required for iron. Vitamin D is a really important vitamin for your baby as it helps to absorb calcium and is really important for strong and healthy bones for your baby. There's enough vitamin D in formula if your baby is getting more than 300 ml of formula per day. So if your baby is taking more than 300 ml of formula in the day, you do not need to give them an extra vitamin D supplement as they'll be meeting their preterm nutritional requirements. If your baby is taking less than 300 ml of formula per day, then they'll need a vitamin D supplement of 200 international units or 5 micrograms once a day until 1 year corrected age. And thereafter, you should follow the HSE guidance on supplementing vitamin D, which you can find on the HSE website. Before you go home from the neonatal unit, the neonatal team, the doctors, the nurses and the dietitian will discuss how much you should be feeding your baby when you go home. When you go home, good signs that your baby is feeding well is that they are happy, settled and content after feeds, that they are growing and gaining weight, and they have plenty of wet and dirty nappies. When you are discharged from the neonatal unit, your nurse will tell you how much your baby should be taking during the day, and as your baby grows and gains weight over the following weeks, you should increase the amount of feed and volume that you're giving to your baby throughout the day. So when you go home from the neonatal unit, it's important to allow your baby to demand feed and to feed them when they're hungry. Some signs that your baby is hungry, if they're showing their hunger cues, such as putting their hands to their mouth, opening and closing their mouth, or nuzzling to your breast. These are signs that your baby is hungry and is ready to feed. So it's important to demand feed your baby once they go home from the neonatal unit. Lots of parents ask us how much weight their baby should be gaining when they go home from the neonatal unit. We would usually advise that weight gain of 150 to 200 grams per week is normal, but your baby's weight will be checked in the outpatient appointments or by your public health nurse or by your GP. They'll let you know if they have any concerns with regards to your baby's weight. Many parents ask us about weaning their premature baby, and we have a really good video on weaning your premature baby up on the Rotunda website. You can follow the link below and it'll tell you more about weaning your premature baby. Usually we would say that 4 months corrected age is the earliest that your baby will show signs of weaning, and usually they'll be ready to start finger foods at about 7 months corrected age. Signs that your baby is ready to start weaning include that they're putting their hands in their mouth, that they're putting objects in their mouth, that they're interested in food and they're interested in other people eating. Your baby should also be able to support themselves and be able to sit upright with a little bit of support, and they should also have good head control before they start weaning. All of the information that we've talked about in this video is in our Feeding Your Premature Baby Post-Discharge from the Neonatal Unit booklet, which you should be given before you go home from the neonatal unit. So this should answer all of your questions. You can also find more information on the Rotunda website.